Good afternoon, I'm Elizabeth Hess. Thank you very much to Urbana Mayor Diane Marlin for letting us continue this series. I would also like to thank Jason Liggett. He is our producer with UPTV. Most importantly, I would like to thank Julie Pryde. She's the administrator of the Champaign Public Health District. Thank you so much for joining me again today, Julie.
Thank you.
Last time we talked, we were talking about serology and testing for antibodies. Have we ramped up that testing yet?
No, actually we're waiting right now to get the test that is going to be done locally. It's in the process of being validated to make sure that it is both sensitive and specific. So meaning it's going to test for what we need it to test for. A lot of the kits that are on the market right now are not useful at all. They have too high levels of both false positive and false negative, which basically renders the test worthless. So the test that we'll be doing locally will be a blood draw test. They'll draw a tube of blood. It'll be what's called an ELISA test, and they'll be checking specifically for the COVID-19. So once we have a reliable test, that will start ramping up just like the original PCR COVID tests were.
And I'm sorry to ask this, but do you have any idea when those tests will arrive or when we should expect ramped up testing?
I believe what Carl has said is probably within the next week. So next week we should have it.
The CDC has said that the virus can now expand to a 13-foot radius. We went from 6 feet to 13 feet. Is that the standard now?
It's still really 6 feet. Of course, the guidance, I don't believe that the guidance has changed to 13 feet, no. But the key thing is to keep distance and wear the masks when you're out, because if you know what the masks do, they're basically preventing you from expelling anything while you are talking or coughing or sneezing or doing anything else that could cause droplets to come out. So it's really important that you do that. And I always like to remind people that it's like when you are outside in the cold and you see that little plume come out, that breath plume, that's always coming out whether you can see it or not. You don't notice it, but other people could be breathing in those droplets and everything. So the mask helps to prevent that from coming out.
I'm glad you brought up the masks. I want to support our businesses. I picked up dinner downtown the other night, about 12 people waiting in a small foyer. Only 2 of them had masks. Are masks protecting me? Are they protecting them? What can we do to impart how important these masks are?
Well, number one, there should not have been 12 people in any foyer. That is not following the guidance in any shape or form. When restaurants are providing carry-out food, it's supposed to be either brought out to the car or it's supposed to be done in a way that there's one person in there picking it up at a time, and everyone should have masks on. Everyone is recommended to have a mask on right now. Starting May 1st, everyone will need to have a mask on. So if you plan to go into the store or you plan to go in and pick up food or anything like that, you need to wear your mask because you're protecting the workers that work in there. Whether you think a mask is necessary or not is not the issue. The issue is that is going to be the order. And ideally, I look around our community, a lot of people are wearing them a lot of the time, which I'm very happy about. But starting May 1st, you need to be wearing some type of face covering. We've got to get it so that this becomes more of the norm, because we have got to protect workers. If we ever expect things to get open, which we all want to happen, we're going to have to get used to protecting workers by wearing masks. So the masks prevent the people who they don't protect the wearer so much as they do the person that could be breathing in your potentially infectious droplets. With that said, the workers also need to wear them so that they then are protecting you. If we don't know who is infected, it's key that everyone wear a mask to prevent any transmission that way. You still have to do social distancing, though. That's also important.
I was concerned that the people in the foyer didn't have them on, and the employees did, so that was a little bit of a comfort. Currently in Champaign County, how many cases are we looking at actively right now?
Well, we have a cumulative total of 105 cases, 6 hospitalized, 19 active. And I do want to, there seems to be some confusion about what active means. Active means those are people right now that are in isolation that we are following up with. There are many, many times more than that, people under quarantine. And as testing increases, we absolutely expect to see those numbers increase of active cases. That's going to happen. So we hope that we can catch, the cases early, but it's important to know that we're not through this. And just because our numbers had been going down, everybody needs to remember that we're going to see like this. And anytime we get an outbreak, so there are certain places where people can't get away from each other, and we try to do personal protective equipment, but places like where it's almost impossible to not have direct contact with people, those are always places where we could have a potential outbreak, and that will make the numbers shoot up if we get something like that.
There are people frustrated in our area because our numbers are low. Chicago, Cook County, the numbers are high, and people want to know, why can't we open more of our part of the state, south of I-80? Yeah. How can we do that? Okay, well, so this is an important concept for people to try to understand. Just the Chicago numbers are not driving what's happening in the rest of the state, if you will. I know that people say, why are we being punished for Chicago? Well, we're not being punished because of Chicago numbers. Chicago numbers are high, yes, but they have a ton more people than we do. It's not based necessarily on the number. It's like the rate of your population. So you have to combine a lot of things, and you're looking at who is being tested, how many people are being tested, how many are in your population, less so even than your population of like your healthcare catchment area. So I have said before that, Carl and OSF are great big, healthcare systems, and we have a lot of healthcare capacity, but they also have a catchment area of well over 1 million people that need to use that hospital. So it has to do with the cases that are out there, and you're looking at the specific areas. So in Southern Illinois, it might not look like they don't have a lot of cases, but they also have very, very limited healthcare capacity in a lot of the rural areas. So that's not just Southern Illinois, that's a lot of places in Illinois and a lot of places in the country. So just because the hot spots, as they like to say, are in the big cities, that just makes perfect sense. That's where all the people are. So you have more cases where you have more people and you have more testing, but we're seeing it on smaller scales all over the place. So again, everybody needs to remember the goal is to keep the healthcare system from becoming overwhelmed. May 31st seems to be the goal. That's where we're sheltering in place now. But magically, the virus isn't going away on June 1st. What happens if we have another spike at the end of May? Do we just keep pushing that date back? Well, theoretically, yes, but I don't look for that to happen. I think that we're going to see the cases start to, even with ramped up testing, we think that, we're going to see more cases, but hopefully we're going to be able to get on top of them and not see as many hospitalizations. Because again, that's what we're always looking for. We're looking for things like outbreaks. We're looking for something that could overwhelm the healthcare system. So I don't look for that to happen. I look for things to start opening up. Places should start thinking about that now. Like, what's that going to look like when we open back up? How are we going to, for the next, however long it takes, a year or more until we have a vaccine, what is that going to look like? How am I going to protect my employees and the customers coming in? And things will be completely different, but now's the time to start thinking about that. I saw a really, really good example of someone in Georgia that had really worked on their salon and coming up with really clever and innovative ways to protect their employees and their customers. And you just have to do things differently. It's by appointment only and all kinds of things like that. So, but it's a good thing to start looking at that now. I can understand pet groomers, which are now open in Illinois. You can hand your pet over at the door. You never have to go inside. But massage parlors and beauty salons, and tattoo parlors. There's no way to do any of that 6 feet away. So do you see that being the next wave to open up, or is that further down the line for service industries?
Well, I don't look for it to happen in May because that hasn't been announced yet. But, certainly at some point, everything except for things that have large gatherings will at some point open. And it just is going to be, I guess we'll be looking at how things, keep looking at the numbers constantly and knowing if we need to make adjustments or close things again. But I think that the real issue right now is the lack of personal protective equipment, because really you could do a lot of things if we had ample personal protective equipment for people, so that if you're doing a certain activity and you have the right PPE, it could be done safer. But right now we're working under a combination of things: the governor's order, which I am very happy about. I know it's really hard for everyone, but it is, as far as public health goes and the healthcare system, it's really a good thing.
I saw a Fox News poll that said 60% of their viewers say they will not get the vaccination when it is available. How troubling is that to you as a public health administrator?
Well, first of all, I don't believe that, but I don't believe that. 60% of that viewership, I have no idea what that number is, but we have to get to herd immunity one way or the other, and we have to deal with people, not getting vaccinations all the time, and it is a problem for public health. And it will probably, I would assume it would be like, other vaccinations. It will have to be mandated for certain places that work with vulnerable populations, places where you can't maintain social distancing, certainly hospitals, public health, places like that, schools, universities. So, I don't know why someone would not want to do it, but it's not a good idea if we're lucky enough to get a vaccine, and there is no guarantee of that yet. I said the other day in an interview that, I was ecstatic when I was working in HIV a million years ago, and they talked about in a few months we would have a vaccine. Well, here I am 30 some years later, and there is no vaccine for HIV. So, it's one of those things where the science will catch up, but it might not be what any of us want or what any of us are anticipating. We just have to work with what we've got and try to protect people as we go along.
When we first started talking about this virus a couple months ago, we were talking about the elderly population, people with compromised immune systems. Now I've heard some scary stories of people in their 30s and 40s who were perfectly healthy now having blood clots and other horrible complications. Has this virus now shifted to, we really don't know who it hits, and it could hit just anybody?
Well, it always could. The thing with any type of viral illness is that there's usually an entire range of things, from people that don't have any symptoms at all, hardly, or mild complications, all the way up to death. And it's always a spectrum. And until you start seeing more and more and more and more cases, which we don't want to see, you don't really know what you're looking at, because all you have to go on is what you're seeing. So it's not like, if we were having an outbreak of mumps, it would be easy to know what to expect, because we've seen mumps throughout history, and we know what to do, and we know how to prevent it, and we know how to address an outbreak. With something like this, we don't know. So it's just like it was early on with HIV/AIDS and with Zika and things like that. When anything's new, you're learning as you go. So we try always to let people know that just because you're hearing more about deaths in one certain population or people with underlying health conditions, a virus can cause meningitis, and cause deaths from that. It can cause it can cause all kinds of problems. So, and it can cause it in young people. And we've seen babies with this die, all the way up to, people over 100 years old. So it's something that people should not take lightly, because like I said, we're still learning, and you don't really want to learn on the people getting the disease, which is indeed how we are learning. And with China, you know, you had the initial cases and then they went into massive lockdown, and so did some other places. So you didn't see this. But as people continue to get infected in the United States, you know, we're up to what, almost are we up to 200,000 now? I forget what day it is, let alone how many cases we have in the United States. But, you know, we have a lot. And probably by the end of the week, we are going to see more Americans dead from coronavirus, which has just been here for, you know, a few months, than died in the entire Vietnam War. And that is really something that's difficult to get your head around. But that's what we're talking about. And that's why we have to prevent the spread as much as possible until we can get to either a really effective treatment or vaccination.
The effective treatment that was questioned this week was ultraviolet light or potentially injecting disinfectant into your system. That was questioned. As a public health professional, what do you know about those issues? Well,
you know, that's another. So when you have somebody that talks about some kind of unproven treatment, and trust me, anytime there's a scary disease out there, most people don't know about it, but when there's any type of new disease or scary disease out there, there is always these kind of weird ideas of treatment out there. And I know that the FDA just actually closed down some church in Florida this week because they were promoting bleach, industrial bleach, as a treatment. I said this at the very, very beginning of the start of this pandemic. You have to get your information from trusted sources. So certainly something like that, a trusted source on a medical thing would be the federal or the Food and Drug Administration, or a physician. You don't just get random information. What was so unfortunate about this is that it was said at the podium, and it was a question that was asked, and then some people, because there always are people out there who are looking for anything to grasp onto, especially if they might be at home and sick and scared. And remember, we have all kinds of people in our country who are, you know, may not have the same ability to determine if something makes sense or not. So it's just, you just have to be really careful about saying stuff like that, because there are always people who would try something. And while I don't know how you would get UV light into your body, I do know that people could and should absolutely not ingest any type of disinfectant. And I will tell you that early on, again, I have to keep going back to HIV, but early on when I was giving a presentation about how to kill the AIDS virus, one of the things that we talked about was that it's relatively easy to kill if it's on a surface, which most things are, because you can disinfect it and clean it and kill it with bleach. And somebody at that training, somebody that I would have thought would have probably known better, actually did ask, why can't they use bleach to kill it? And I said, well, because that would kill you. So, so there's, you know, cleaning something on a surface and dealing with the physiology of a body, that's completely different thing. So again, get your information from trusted sources. That is not generally the internet. If you get sick, get medical advice. Always get medical advice. Do not try to treat yourself with anything on the internet or the news or anything like that.
Something we all learned in high school, abstinence is the best way to not get pregnant. I'm hearing from you that not going outside if you don't have to is the best way not to get the virus. If you have to go outside, wash your hands. I mean, it's sort of, I know that's an odd connection to make, but it's that simple, right?
It is. I mean, the reason for the stay-home order and to stay away from people is because the virus cannot magically travel on its own. It goes person to person to person to person, and it can go person to surface to person to infect. So yes, if you can, and that's why we're really, really early on even stressing for people who are older or who have underlying health conditions to stay away from people if at all possible. Because, and really anyone, if you can stay away from people, then you don't have to worry about getting it. People who have the public facing jobs though, they are at increased risk. And so all of us need to take that into account and be respectful of people who are working in these jobs and helping us get the food we need and helping us, get the medical care we need and the drugs we need and the things like that. And wear a mask for their protection, please.
If workers go to work and are concerned that their employers are not keeping them safe and keeping them as healthy as they could, are you a watchdog group? Who should somebody call if they feel that their lives are in danger or they want more PPE or their employers aren't stepping up?
Well, the employers do need to step up and they need to purchase the PPE for their employees. That needs to happen. Some of the places, there are a lot of jobs out there that are not big places where, they can get the PPE. And so luckily we're having this cloth mask drive and hopefully we can get those out to some of the places that need it. But if you're a big, a big employer, and it doesn't matter whether you're a school or a factory or any type of thing like that, if you're a big employer or even, stores, you need to have PPE for your employees. And if that means that you have to purchase cloth masks off the internet, then, or get some kind of scarves or something, then that's what needs to happen. What I would also like to see is for places to start putting up signage to say, like we used to have no shirt, no shoes, no service. Remember those?
Of course.
We don't need those signs anymore because we've changed the cultural norm. Nobody tries to go into a store without a shirt in anymore. I haven't tried that since the 80s. But kidding. But I mean, seriously, that used to be a real thing. When we were kids, there were always signs up, no shirts, no shoes, no service, and they would boot you right back out. And that's a public health rule. And we don't need that anymore, but we do need signs up that say no mask, no service. Because again, that's protecting your employees and it's protecting others in your workplace. So that is important. And we do need to get into that because we're into this for the long haul. So we might as well start getting used to that.
One of the things I'd like to ask you about before we let you go is I've seen some pleas on some of the internet sites for diapers and formula, expensive things that babies go through quickly. Does CUPHD take collections on that? Is there a centralized place that if you are in a position that you can buy more, that you can donate those?
Okay, so with the formula and things, we need to, if somebody is eligible for WIC, and WIC has a pretty high income threshold, so if you are eligible for WIC, number one, get signed up for that. That is through public health. We have curbside service now, so that will help you get the not only formula but also food for kids and pregnant women. So we need to get you hooked up for that if possible. And we also have diapers. The United Way has diapers through the diaper bank, but again, you need to be hooked up with a service for that. A place to call if you are looking for any type of assistance, first place to call is 211. We're getting lots of enhanced information out to the 211 call center, and they can help direct you to places. But WIC is a good option for people who, and you don't have to have been on WIC ever before, but now you may be. Maybe you've lost your job or your partner's lost your job. Call up and find out if you can get associated with WIC because it's got a lot of help out there for you and a lot of good information. So that's a good place to start. Start with 211, and if you're looking for formula or diapers, see if you're eligible for WIC.
And at 4 o'clock every day, are we still seeing an update on the website and the Facebook page of information for CUPHD?
Yes, we were still updating that every day, 7 days a week.
Great, thank you so much. Urbana Mayor Diane Marlin, Jason Liggett, thank you so much for producing this. Again, Julie Pryde, you are community treasure. I say that every week and I really mean it. You are the administrator of the Champaign-Urbana Public Health District and we couldn't do this without you. Thank you so much.